Welcome back to Left and Right. Joining me today talking about obesity is Dr. Bernstein from the Dr. Bernstein Clinics. When we left, we talked a little bit about some of the processes of what Dr. Bernstein is doing, but I made mention of a brand new technique which is called Nutrigenomix. And joining us today is Ms. Jennifer Ozsungur and Mr. Stefan Ozsungur, and they're going to speak to us today about Nutrigenomix. Thank you very much for joining us. Nutrigenomix. From what I've read and from what I understand, first of all, it's revolutionary, 2012, which is last year. Right. But more importantly, it is something based on DNA that you can utilize the DNA of a patient that could conceivably assist in a pathway to weight loss. How does that work?
So the test itself comes in a kit like this, and like you were saying, it is a saliva collection, so it's very simple and straightforward. And it's the first time that we're able to actually have a program where we can help and assist patients eat according to their genes. So we look at 7 different dietary components, one of them being saturated fats. Which is obviously related to obesity if you have too much of it in your diet. And once
it's one contributing factor. Yeah.
Right, one of the many contributing factors. So basically, we analyze all 7 dietary components and develop sort of a report that helps us understand if you have an elevated risk of developing a deficiency in certain areas. And Stefan will talk a little bit more about the saturated fat gene in particular, which is related to obesity.
Yeah.
But sorry. You have a medical degree, or no, you have a
Masters of Science in Nutrigenomix, yeah.
Right. So Nutrigenomix, I mean, I would consider myself relatively well-read. I have yet to hear a lot about this. How did you come about this? Is this something is this something that it feels like there's a bunch of Swedish guys who eat cod all day and there's a fish? How did you get? I'm not trying to be disparaging to Swedish people, but it's like one of those things where how did you get to that? Nutrigenomix. It sounds like.
No, it's a great question, Michael. Actually, nutrigenomics or nutritional genomics is the idea that people are different from one another. We look different from one another, we behave different from one another. In the same token, we respond to foods differently, and that's due to genetics. When there were studies being done to understand if one dietary component increased or decreased our risk of certain diseases, there were always inconsistent results. And there's a possibility that people being different from one another was the reason why genetically different is people are responding differently to those dietary interventions. So the idea is that, in a sense, there is a genetic component to in our topic today, obesity. The latest research showing from UCLA that a high caloric diet, high saturated fat diet is linked to obesity in certain genetic populations.
But not to be combative, but that's general knowledge. I mean, we can get to that. What is the key that you can identify through nutrigenomics? Is there a particular DNA strain, or is there something that you can identify that has a huge effect on us that we may not have acknowledged before? So is that where we're going with this?
Yeah, that's a great question.
Okay.
So the idea is that genetics are involved. The second step was to figure out which genes that we need to look at to understand A, for prevention, and B, for treatment, what we need to do. So the latest gene that's been repetitively shown to be involved in the risk of obesity with high intake of calories is the apolipoprotein, APOA2 gene. And there's a certain variation in about 15 to 20% of the population that if those people have that genetic variance, when they go above 10% of their caloric intake and energy caloric intake in saturated fats, or average of 20 grams or more of saturated fats, their risk of developing obesity is 70% compared to the rest of the population.
Is it genetic? Is it something that's hereditary? Is it something you can evaluate in 2 parental units, and if they both have that gene, that there's a higher propensity for any offspring to have that as well?
I mean, you can definitely try to devise that, whether or not if the 2 genes are present in the parents, that most likely you're gonna have it in the offspring. But unfortunately, we always deal with one copy of each gene, one from the parent, one from each parent.
Right.
And the possibility is that if one of the codes that code for that risk is evident in both parents, they can actually give birth to an offspring that doesn't have the genetic risk or does. So there's a 50-50% chance depending on what the genetic makeup is of the parents.
Dr. Bernstein, I want to bring you into this discussion. I find this fascinating, again, how science continues to explore different avenues. And what Stefan and Jennifer are talking about is something that's DNA-based. Would this play into anything along your lines with the caloric intake?
From our practical point of view, it would be nice to know if there's something that we can tell a patient and identify that you're at a greater risk for becoming overweight. And in managing a patient, if we know that we can take you and restrict your high fat intake even more efficiently, it will help better. Sure, it's important. All the more information we can achieve could be helpful.
Statistics say that 23% of Canadians 18 years of age and older are obese. We're all getting bigger butts in this North American world. It's easier to get fast food. Two-person family, two-person working family, mother and father, or there's always somebody working. Children, key holders that access the home after school themselves. Social media. I mean, we were speaking to Isolde in our first segment about the sedentary lifestyle and the lack of exercise. With these techniques, your Nutrigenomix, and with a caloric intake regimen that Dr. Bernstein's clinic is speaking to, do we have a gateway? Do we have a hope that we'll be able to change something? Just recently, the American government, particularly in Washington State, I believe it is, they eliminated now, or the government is saying, no fatty foods, no high caloric intake. They're starting to reduce
pops, sugar.
I mean, you look at Mayor Bloomberg, you can't have large soda drinks. Some would say that's infringing on our rights, but there becomes a point, and Isolde brought this out in our first segment, speaking to the high cost of medical care. Is this a gateway? Are we going to be able to capitalize on this? Are we going to be able to one day take this as an evaluator and use something that Dr. Bernstein does as an executor? Are we making any headway?
I think the Nutrigenomix test, it is very new, but there is a lot of research supporting, it's obviously its benefits, and there's been a lot of research done on all the genes, well over 10 years of research. So we know it's legitimate, we know it's accurate, but it is just one component. So when we do the Nutrigenomix testing for our patients, we couple that with a few other things. So we do a full assessment to get a sort of sense of their past medical history. We do food records, we do food frequencies, to get a sense of how they're eating. And we, based on that and the results of Nutrigenomix, we're able to tailor a custom meal plan for these patients. So I think it's definitely an important component, and I think that 10, 15 years from now, I think this is sort of where dietetics is leading. I think every dietitian will start using this because. So
you both took the test.
We have.
Did.
Obviously,
Yes.
you took the test, and it's not anything that's going to leave any scars. What did you find out about? Look at.
Yes.
What did you find out about yourself? Obviously, donuts are fattening. I mean,
Yes.
ironic today coming to the studio. I said when he came in, I'm going through and purchasing donuts for the crew, and whose commercial do I hear on the radio? This guy's hearing the birds. Like, oh my God! So what did you find out?
Let me
look
mention
at the smile
there
eat your ear right now.
There are 7 components that we look at, one of them being the obesity factor, but this is a test that would help us prevent chronic disease in the future. So what I found out was that, for instance, the Health Canada guidelines of the upper limit of 2,300 milligrams of sodium a day is way too much for me. I have a 150% increased risk of developing hypertension if I don't limit it to 1,500 milligrams a day. But according to the Canadian guidelines and according to general guidelines that any doctor, dietitian that would give me without this test, 2,300 is okay for me.
You're watching Left and Right. We're talking about obesity. My name's Michael Lake Charval. I hope you will join us when we return. We'll be back with more right after this.